Hello everyone, this is Metamorphosis. We mission to transform medical science complexity into clarity for you all to understand it better. Today we are discussing necrosis. It is one of the most important topic of pathology. So let's begin. What is necrosis? Necrosis is uncontrolled, irreversible cell death caused due to external injuries like infections, hypoxia, ischemia, physical trauma, toxins, and radiations. Hypoxia is a lack of oxygen supply to the affected part. Ischemia is a lack of blood supply caused due to the obstruction of blood vessels to the affected part. Physical trauma such as burns or frostbite. Moving forward, necrosis. It is a morphological changes indicative of cell death in the living tissue following harmful injuries. Necrosis is the main indication of a cell death. Necrosis is an accidental, unregulated form of cell death, results from damage to the cell membrane and loss of iron homeostasis. Homeostasis is an ability of a body to maintain equilibrium between its internal and external environment. Necrotic cells cannot maintain integrity of cell membrane and results in leak out of cell organelles or contents. This brings out acute inflammatory reactions in the surrounding tissues, which results in pain, the increase in body temperature, swelling, and redness. There are basically 6 types of tissue necrosis. First is coagulative, second liquefactive, third caseous, fourth fat, fifth fibroid, and sixth gangrenous necrosis. Gangrene is a different pathological conditions characteristics by cell death results in blackened and decay of the affected part. This we will discuss at the end of this video. Let's start with the coagulative necrosis. Coagulative necrosis. It is one of the most common type of necrosis, in which cell death where the tissue architecture is preserved for some time even though the cells are dead, commonly caused due to ischemia. Infarct is a localized area of coagulative necrosis. Ischemia denaturates and coagulates structural protein and enzymes in the cell, results in the stoppage of enzymatic activity. Grossly, it affects all organs except brain, most frequently caused in heart, kidney, spleen, and limbs. Appearance. It's dry, pale, yellow, and firm, as you can see in the first figure. In wedge-shaped organs like kidney and spleen. Microscopically, indistinct outline of shows nucleus either be absent or shows karyosis. Key features of coagulative necrosis. Tissue structure is preserved, nucleus disappears over time. Cytoplasm is pink and granulated, as we can see in the figure third. Inflammation is mild to moderate, commonly caused due to ischemia. Most common example of coagulative necrosis is myocardial infarction or heart attack. The affected heart tissues undergoes coagulative necrosis. The most important part to be remembered is all organs except brain. That is, brain does not show coagulative necrosis. Moving forward to the type 2. Liquefactive necrosis. Liquefactive necrosis is the type of necrosis where dead tissue is digested into liquid viscous mass due to the enzymatic breakdown commonly seen in brain and bacterial infections caused due to enzyme released from leukocytes accumulated at the site of necrosis. Dead tissues rapidly undergoes softening and transforms into liquid viscous mass. Infection by bacteria stimulates accumulation of leukocytes. Liquefaction is due to digestive action of hydrolytic enzyme released from the cell death and leukocytes. Grossly, the main organ affected by the liquefactive necrosis is brain. The necrotic area is soft and centers show liquefaction. Abscess is the localized collection of pus. Microscopically, pus consists of liquefactive necrotic cells, debris, dead leukocytes, and macrophages. Macrophages are also known as scavenger cells. The question is, why only brain is affected? The brain has high lipid content and low connective tissues. Lack of structural framework to hold tissue together. Liquefies easily after ischemia. Key features: appearance is soft, liquid pus-like, tissue structure is completely lost. The main process occurs in liquefactive necrosis and enzymatic digestion. Common site is brain and abscess. Inflammation is predominantly seen. In microscope, we can see numerous neutrophils present at the site of infection. Cavity with liquid debris and dead cells are completely digested. Moving forward to the type 3, caseous necrosis. Caseous necrosis is a type of tissue death where the necrotic tissue is cheese-like, soft, white appearance typically seen in tuberculosis and some fungal infections. It is a distinctive type of necrosis which shows both combination features of coagulative and liquefactive necrosis. Characteristics of tuberculosis and is due to hypersensitivity reactions. Infection triggers strong immune response. Macrophages engulf bacteria but cannot destroy them completely. Chronic inflammation leads to the formation of granuloma. In the center, cell dies and form granular cheese material called caseous necrosis. Grossly, it affects lung and lymph nodes mainly, but may also involve any organ. Appearance is yellowish white, soft, granular, and resembles dry, clumped cheese, hence named as cheese-like necrosis is caseous necrosis. Microscopically, we can see focal agents of tuberculosis, which may be caseous or non-caseous, that is soft granuloma or hard granuloma. Caseous necrosis appears eosinophilic, coarsely granular material. Ligand's type of giant cell, nuclei arranged in a horseshoe pattern. This is the horseshoe pattern. May undergo dystrophic calcification. Contains microscopically we can see lymphocytes, fibroblasts, granulomas, and eosinophils. Fat necrosis. This is the fourth type of necrosis. Fat cell dyes release fatty acid that combines with the calcium to form chalky white deposit, often seen in acute pancreatitis trauma due to fat tissues like breast. It refers to the focal area of fat destruction which affects adipose tissue. There are two types of fat necrosis is enzymatic fat necrosis and traumatic fat necrosis. First, we'll see enzymatic fat necrosis. Occurs in adipose tissue, acutely inflamed pancreas. In pancreatitis, enzyme leak, one of them is lipase, leak from acne cells and cause tissue damage. Lipase breakdowns triglyceride, release free fat acids. Fatty acids binds with calcium, forms calcium soaps. It appears chalky white in area and foam deposit in tissue. Microscopically, we can see fat cells pale with a shadowy outline surrounded by inflammatory reaction. Second is traumatic fat necrosis, occurs in tissues with fat content such as breast or thighs following due to several traumas. We can see it in figures. This is the chalky white deposit in the fatty tissues. Microscopically, we can see basophil's calcium deposit, which is purple and blue dots, area of sulfification containing fat and calcium, surrounded by inflammatory cells such as macrophages and neutrophils. Clinical examples are acute pancreatitis, traumatic breast fat necrosis, and abdominal trauma. Moving forward, fibrinoid necrosis is a form of tissue death where immune complexes and fibrin leak into vessel walls, making them appear bright pink and fibrin-like under the microscope. Typically seen in immune-mediated vascular damage, deposition of antigen antibody complexes in the walls of vessels. Deposition of pink staining proteinaceous material in the tissue matrix with a staining pattern reminiscent of fibrin. Antigen antibody complexes deposit in the blood vessels. This activates the complement system, leads to inflammation. Vascular injuries, vascularitis, malignant hypertension, rheumatic heart disease, placenta in preeclampsia, or hyperacute transplant resection. Microscopic shows fibrin-like appearance, vessel wall becomes thickened, eosinophilic, pink, and necrotic. Epithelial damage, protein plasma like fibrin leaks out. Let's move forward to the sixth type, gangrene. Gangrene is a death of body tissues due to loss of blood supply, infection, trauma, leads to tissue decay, black discoloration, and sometimes foul smell. It is caused due to loss of blood flow, lack of oxygen and nutrients. Cell death and necrosis occurs in the part. Sometimes infection sets in, worsen the tissue destruction, may involve coagulative, liquefactive, and gas producing necrosis depending on the type. There are two types of necrosis: gangrenous necrosis, dry gangrene, and wet gangrene. A variant of wet gangrene is gas gangrene caused by Clostridia, a gram-positive anaerobic bacteria. Let's discuss dry gangrene. It is caused due to the arterial occlusion. Occlusion is the complete blockage of vessels, leads to complete stoppage of blood supply to the part. Example, atherosclerosis. Generally involve distinct part of lower limb, example foot, toe. Grossly affected part appears dry, shrunken, dark brown or black in color, resembles the foot of a mummy. Black color is due to iron sulfide. A line of demarcation is seen between gangrenous and adjacent normal area. Microscopically, necrosis is coagulative type of necrosis, shows tissues and overlying skin. Line of demarcation consists the granulation tissue with inflammatory cells. Gangrene predominantly consists of coagulative type of necrosis. Moving forward is wet gangrene, caused due to venous blockage. Example, strangulated hernia. Site occurs in moist tissues or organs, bowel, lung, mouth, etc. The moist tissues grossly appear soft, swollen, prurite, and dark. There is no clear line of demarcation. Microscopically, it is liquefactive type of necrosis. Wet gangrene predominantly consists liquefactive type of necrosis. Colonious gangrene seen as cortical cells. Moving forward to the variant of wet gangrene, that is gas gangrene. a special type of wet gangrene caused by infection with the formation of gas caused by anaerobic clostridia. These organisms enters into tissue through open contaminated wounds such as muscles, complicated or operative procedures on colon. Toxins produced by them cause local necrosis and edema and are also absorbed, causing systemic manifestations. Gas gangrene is a variant of fat gangrene caused by Clostridia, gram-positive anaerobic bacteria. Thank you everyone for watching it till the end. If you like this video, please like, share, subscribe and comment. Please help others by sharing this video and subscribe to my channels for similar content. And please share your opinion about my content in the comment box. Thank you so much.